one of the great lies, and that's part of that stigma of the disease that we have to educate. What would you tell me if I was a diabetic and I had to go on insulin? You're not going on insulin. You're substituting one for a chemical God already made for you. You don't hear that argument ever.
No.
Nobody tells me, Dr. Kearney, you're taking that beta blocker for your blood pressure, and you already produce that in your body. You just substituted one thing for another. You don't need to be taking that. No, I have to take that. You know, I've got a deficiency. Once that neuroplasticity happens, guess what they have? They have a chemical deficiency. So that's why we're stabilizing it. We're putting something in to balance, to try to get the balance, to get the soup right again. If you're cooking for 10 people and you're making a pot of soup, and you got all your ingredients in and you do everything and it's all good, everything's great. Perfect. Well, now let's say that 10 more people show up. So now you got 20 people. Well, you could double your recipe, but it may or may not be right. It may be too much. So you sometimes have to juggle the chemicals a little bit, and this is what we're trying to do. We're trying to get what's called homeostasis, equal playing ground. They've lost that. That's a brain disease. Their brain's not the same as us. It's not a chemical substitution. What happens if it's a chemical substitution? What happens if you take OxyContin off the street and you decide, yeah, I'm going to get treatment, I'm going to go next door and get the heroin? Now that's a chemical substitution, right?
Yeah.
But what's the difference? Well, number one, you're supposed to be getting medical care when you come here. You're under the care of physicians that are looking at your progress, and we're monitoring. And during that stabilization period, we're not just putting a pill in you. We're trying to change your life. What are we trying to do? What's our big goal here? We're trying to share the gospel. We're trying to get people connected with the cure and the solution. But they can't do it when they're puking and pooping on themselves. They're having chills and shaking. They can't hear that message that there's a better way. So you have to address the medical issues. This is a brain disease. That argument makes a lot of sense if it's not a disease. That's exactly where that Harrison Narcotic Act of 1914 came in. That was exactly the point. So we haven't gotten any better, we haven't gotten any smarter in 100 years. 100 years, we still have the same mentality? Come on.